Review of Amendment 1 to Resolution 20-2297, review of Section 6 mask mandate with Jason Tiller, Health Department Director.
Well, good morning, Mr. Tiller.
Good morning, Commissioners, members of the public. Just as soon as Phil gets these slides up here. All right, so here's our 2-week update for March 30th. Next slide, please. I do have to mention that yesterday was a year since our first case of COVID was reported here in the county. I don't think any of us thought a year ago that this would still be going on at this point, but just looking back, we've reached that milestone, however you consider that milestone. Next slide. Looking at the national picture, or excuse me, the national update, U.S. cases still continue to drop overall, although there have been some increases in other states, and U.S. deaths are down, excuse me, down as well. Next slide. State of Kansas continues to see this same trend. Deaths are down, hospitalizations are down, positive cases are down. Next slide. And that trend continues to carry over here into Saline County as we see our continued trends are trending down. Eradication is certainly not likely, but we are still trending in the right direction. The hospital is, on Friday we reported that the hospital has 0 COVID patients. They did get another one yesterday. And so that is unfortunate. However, still looking at extremely low numbers based off of where we were even a couple months ago. Next slide. So when we look at the cases per month, we can see that for the month of March, Saline County had 126 cases, which puts us pretty close to where we were last summer in terms of case numbers when the mask mandates were put into effect. Next slide. The same thing with deaths. We've only experienced 2, thankfully, in the month of March. That's still in line with where the deaths were at during that summer last year. Next slide. Due to the lack of continued demand at the testing site that was at the Church of the Cross, that site has been closed down by the state. There are other places still. If someone is looking to get tested, they can either call their primary care provider or go to that website, gogettested.com/Kansas, and be able to find a site and contact information for a place to get tested. Next slide. In terms of vaccine, we are registering and vaccinating all phases 1 through 5. You can either go to the vaccinatesalinecountykansas.com website to register. There are also other places such as Dillon's Pharmacies, B&K, Key Rexall. The hospital, I believe, is receiving some this week. And so there's continued widespread availability of vaccine for those who want it. Now, the 70% that I've mentioned in the past still was just a goal. It was not a hard and fast that no action could be taken or was recommended until that. But I do think that we still need to get closer to that. We're currently, as of last week, 28% as we moved into this week with vaccination. And I expect that we'll be closer to 33 to 34% by the end of this week. Next slide. Again, if you're looking for where to get vaccinated, you can go to vaccinefinder.org. This website is supported and run by the Centers for Disease Control, and it will list the areas not only here but throughout the state or throughout the U.S. if you happen to be traveling or moving somewhere else, or you're looking for where to get a second dose if you happen to move here in the meantime after getting your first dose. And it will show the location as well as contact information. And then it will also show availability, how to schedule appointments, and that type of information. Next slide. As always, there still continue to be multiple places where you can find out what's going on. Radio, our newsletters, our VaxFacts, social media, our FAQ Friday videos, the Saline.org coronavirus page. Next slide. Few additional updates here. KDHE has recently added states back to the travel-related quarantine list. That would be Delaware, Michigan, Rhode Island, New Jersey, and New York, along with those other countries. And I want people to understand that KDHE has a algorithm or formula they use in order to determine which states need to be on this quarantine list. But it boils down to a state has to have a case rate 3 times worse than our own to be on this list. And it has been quite a while since any states have been on the travel-related quarantine. Next slide. We continue to watch what's happening with the variants in the United States and in Kansas. In the last 2 weeks, the number of cases that are due to variants have more than doubled. Kansas does not have a public spot at this point, and they didn't have an update either since the March 11th one on the number of variants cases. But we have not had any cases that we are aware of course, related to variants here in Saline County. But that is an area for concern that we just continue to watch and evaluate. Next slide. So I don't know if anybody has seen this before, but when we're talking about all of the different things that are done, whether it's masking, hand washing, social distancing, vaccination, isolation, quarantine orders, and staying home when sick, none of those things are individually 100% effective. However, like Swiss cheese, when you pile several of them together, you increase the defense level to improve conditions overall. Now, I'm going to point out the obvious fact right here that under the side of personal responsibility, it does say mask. I think that, though, as well is given that if the majority of people are wearing masks, that improves its efficiency. But no one measure, and really masking is the only measure that we have left that's not a recommendation, but no one measure is particularly effective on its own. It's the culmination of all of these things that improve that defense. And so, last slide, please. So my recommendation for right now is to continue the mask resolution. A couple of other things to consider is that when we have made changes, we have tried to look at what has happened in that 14 days with case rates after those major changes. 7 days ago, we had 2 major changes, really, if you will. One of them was the expiration of the mass gathering order. And then secondly, everybody for all of the school districts came back to school from spring break. 7 more days will kind of tell the tale about what happens after those events. Masking is also the least invasive. And this decision does not come from just a simple, this is the easiest thing, because it certainly isn't by far. But this is also with feedback and discussion from school district leaders, physicians in charge of both Salina Family and Salina Regional, as well as, I think it's also my duty as well to make the best practice recommendation to the commission for continued best action at this time. at least until we see trends that are below where we were when we started wearing a mask several months ago. And with that, your questions.
Any questions or comments by the commissioners?
Commissioner Shadwick here, and I have a couple questions. Jason,
Yes, sir.
when people get vaccinated at other facilities besides the health department's collaboration at JCPenney's, are we aware of that, and does that figure into our figures?
Yes, sir. Recently, KDHE has started providing a report to us weekly that shows us also people that have been vaccinated other places across the state, and so that we are able to tie up or narrow down that percentage with some better predictability than just the number of vaccines that we have given overall.
That's good to hear. I'm still concerned about the 29,000. I'm not so sure that we will ever get 29,000 with people not wanting to do this for whatever reason. Are you still sticking with that 29,000 as your recommendation to the city and the county as when your recommendation for the mask mandate would go away?
As a goal of trying to reach that, yes, with the understanding that we certainly understand that there will be a point where the demand has been, for all intents and purposes, satisfied at this point. And so that will also have to be a part of the discussion once we reach a point where people are not wanting to get vaccinated anymore. But we still have, at this point, significant demand for vaccination.
Any other comments?
Yesterday, there was some news release that some Johnson & Johnson vaccines became available.
Yes, sir.
Were all of those able to be distributed?
All of them yesterday during that pop-up clinic, with the exception of about 20, I believe. And then the rest of that, along with some other that had been set aside, is being used at a targeted clinic this morning at Salvation Army, trying to outreach for hard-to-reach individuals.
Was that an unexpected arrival of vaccine that
No,
made it
that
so
was still
impromptu?
part of the Johnson & Johnson allotment that we had gotten at the beginning of the month. From that particular allotment of 500 doses, throughout the month, we have been trying to provide vaccination and reach people who are normally hard to reach, such as homeless, homebound, those that are at some of our places like the Rescue Mission and Ashby House and some of those areas, especially, too, those that are hard to reach with one dose, let alone to try and find and reach again for a second dose.
Thank you.
Any other comments?
Well, at this time, we're spinning our wheels here. If we decide to vote today against the recommendation of the health director, and 3 of us decide out of the 5 that we want to repeal the mask mandate that we have in place in Saline County, it's a moot point. The city still has a mask ordinance in effect. The state of Kansas still has a mask mandate in place. So we can repeal it today, and it does no good. You're still going to be wearing a mask. And I think that we need to back off another week, wait until the city commission comes back into session, work in tandem somewhat with the city. It does no good for the county to have an ordinance one way and the city to have one another. We need to work with them in terms of a 12 or 24-hour window instead of a 1-week window. We're spinning our wheels. I mean, I would say that we amend this. I don't know if it's even in the resolution that we have, but we come back in 1 week instead of 2. And that would be right on the heels of the city making their decision on what they're going to do. Otherwise, it's an exercise in futility.
Commissioner Shadwick here, and I agree with Commissioner Vidrickson. The city really is driving this bus. When I voted for the mask ordinance and made it 3-2, my reasonings were two things. One was to stay consistent with the city. I didn't see there was any reason for the rural areas to be different than the city areas as far as law enforcement. And then second of all, my third vote was also predicated on my worry that we are overwhelming the hospitals. That is obviously not happening right. Not saying that it couldn't take an uptick, but that's why I was in support of this. To respond to both sides, because I think we're all getting hit a lot out there in the public. First of all, when people talk about their freedoms to do whatever they want, we're still a nation of laws, resolutions, and rules. You do not have the right to drive 100 miles an hour down the wrong way on the interstate drunk. You do not have the right to smoke in restaurants. I could go on and on and on. Those are rules that your representative democracy or people have put into place. To the other side, and to my commissioners, this will end at some point, and people on that side will not be happy. There are some people out there that never, ever, ever want this to go away. There will always be the next event. There will always be the next holiday. There will always be the next strain. There will be the flu season that comes. So we got to be careful that, listening to that side, yes, there are constituents, but at the same time, they're never going to be happy when this is over. The government portion of this it should come to close here pretty quickly. Private citizens still have the right to wear a mask. Businesses still would have the right to enforce it in their own businesses. But as far as the mask mandate, I'm hoping it comes to a close here soon. But just to close, I agree with Commissioner Vidrickson. There's no reason for us to vote today or next week. The city hasn't done anything. Thank you.
I would, Chair, I'd like to ask some questions of council, if I could, on legislation that has just passed the state and how it impacts our ordinance. If I understand the language of it, if an ordinance is detrimental to the operations of the businesses then can reach out through district court and get relief from the county. Is that correct?
It gives the businesses or...
Sorry.
It would give the businesses or an individual the opportunity to go to court and ask the court to review whether it's a resolution passed by the county commission or if it's a local health officer order. And it's kind of interesting because there's two different standards there. One of them seems to be tailored more toward gatherings, the one dealing with the county commission's resolution, and the other that deals with mask mandates also references the gatherings, but the language talks about being specifically tailored to a particular event as opposed to the language that dealt with the gatherings. And so Senate Bill 40 seems to deal a lot with public gatherings as opposed to mask mandates. And so that'll be something that have to be addressed in the court if that's challenged, but it does give an individual or business an opportunity to address that.
The only thing that gives me concern and pause is Section 4 of the mask mandate, where it does address gatherings. And I think if the mask mandate's going to stay in place, I would like to see some of the verbiage struck from that mandate. Item F refers to restaurants. Persons who are seated at a restaurant or establishment that offers food or beverage service while they are eating or drinking. These are people that you're exempt from wearing a mask. But then it goes on to say, provided they maintain a 6-foot distance between individuals, not including individuals who reside together or are seated together, with only infrequent or incidental movements of closer proximity. I believe this does put a burden on restaurants as far as how many they can have in their establishment, how they have to set up their seating and all that. And in my estimation, that a business owner would have probable cause to say that it was detrimental to them, because he can only have so many people in his establishment. I would like the exception to stay there, and all the verbiage after while they're eating and drinking be stricken from the mandate, but I'm one person.
Very enlightening. Thank you.
Did our exception, the mass gathering exception, would that eliminate that part of it or not, or?
I'm not sure I'm following your question. There's no, the mass gathering limitation was a health order, and it has ended.
Well, I'm trying to build on what Jim's asking, and that is, this is in here, and it does say the 6 feet should be maintained. I mean, is that still part of the mask mandate? I mean, do we need that in there? I guess is what I'm asking.
It is part of the resolution that you all adopted back in July. Whether you need it in there is, I guess, a decision for this body. Certainly, if there's support by 3 of you to strike it, we could bring that back. That's not an issue.
Well, I don't want to make it any harder than what it already is, so I mean.
I was just going to say, I think that language in there is reflective of the ability of that group of people to be able to remove their mask as long as they're 6 feet away from another group. How necessary, I think it's a conversation about that part of it. But that's what it was in relation to, my understanding, not in relation to preventing any type of gathering, but in order to be able to take the mask off while eating.
Well, I'll go back to my original statement. That is, I'm okay with leaving this alone for 1 week.
I got a quick question, is that in attending a few of the, Saline County has had some rather large events in the last month, and let's start with the Equifest. And I know there was a lot of vendors there from all over the country. A lot of those states and places they came from did not have mask ordinances. We had a lot of attendees and vendors there from different counties here in the state of Kansas that did not have mask mandates. And in talking to a lot of the vendors and other people that were walking around, there's been a lot of those places, and they come from that did, their areas were lower, as lower than any people that had mask mandates. And also then attending that, and then just attending the farm show last week. And I was just, same situation, hardly anybody running around had mask on. It was just very open, same way going to the Liberty football game. You walk in the door, you have your mask on, you take it off, and you go about your business. The people going up to refreshments to get that, they would put their mask on. Some would not. Has there been, and I keep looking at the numbers, and even after all of this, have you heard of any instances where across the state, anybody that had attended these have had any influx of the virus at all?
No, I have not heard of any outbreaks really.
Okay. And I just, I'm just wondering, it's like from the beginning, it's just another one of those on and on. I understand where we're at, and it's like a large percentage of the people are out there going, let's remove the mask. I'm just something that was said this morning, and it just kind of hit me as like another week, 2 weeks. It doesn't matter. I mean, we've put it off this long, and every time we sit back and say that, we go a week or 2 weeks. The thing about it is that I look at this going, not in favor of it, never really have been, but it's another situation where I look at it as going, what's a week or 2 weeks? And the reason why I say that is just this morning, something was talked about the fire where a big brush pile of embers might be sitting there, but until we have that wind come up to 30, 40 miles an hour and reignite it and going, I kind of thought about that going, okay, if today we remove the mask and everybody sat back and said, okay, we can go do whatever we want, I'm in favor of it. But I look at it, what happens when that ember goes back? How much harder is it going to be to put the fire out? So I'm looking at it as we can go a week, 2 weeks, and then look at it strongly and go, Mr. Health Department, what do you think?
Well, I certainly think that analogy is really relevant. And I think that we are kind of in that spot where the ember could burn out or it could ignite, considering that. Thanks. I certainly think that we are in a spot with that analogy that it could either continue to just burn out, it could continue to smolder, or it could reignite. I mean, there's really at this point no way in knowing which way it's going to go, other than continue just watching conditions. I would just add, though, that if this commission, and this is, I think, in respect to Bob's comment, because it is significantly more burden on the city. So I think whatever we decide to do requires a coordinated effort with the city. But just keeping in mind that if this does turn into, a wildfire again, that was a possibility of removing this, and that then we'll have to address it at that time.
Okay, all right, thank you. Any comments by the public?
Mr. Chairman?
Yes.
We do have somebody in the Zoom meeting that would like to speak.
Okay, go ahead.
Lene, go ahead and unmute, and you can speak.
I would just like to say I want to thank you for your wisdom and taking a look at a big picture. I don't envy Jason's responsibilities. That's a heavy load, but I think you're all making the right choice. And I thank you very, very much. I feel safer because of your decision. Thank you.
Okay, next.
Mr. Chairman, I do have one additional person in the Zoom meeting who would like to speak.
Okay,
Mr. Farber?
go ahead.
Hey, Commissioners, Chad Farber again. I just wanted to address some of the things that you guys said. First off, Mr. Chairman, we've been pushing this back for a week or 2 weeks for about a year now. Well, since July, since you guys passed this mask mandate, and you kept saying we will revisit this in 2 weeks. We'll revisit this in 2 weeks. And I want to know, when's that going to end? You can keep pushing it back 2 weeks indefinitely.
Yes.
And I feel like that's kind of what is taking place here with this board. I agreed with what Mr. Tiller said about his Swiss cheese illustration. Masks are just one part of the answer to what we're going through. But I think we as citizens are smart enough to put in place those other barriers. Even if the mask mandate is not there, we can put those other barriers in place so that we can protect ourselves. And that's what we're asking for, is just individual freedom to protect ourselves. To address Mr. Vidrickson, waiting on the city to make a decision. You guys as the county commission are not there to wait until the city makes a decision and then you make your own decision. It's time for you guys to make a decision on your own. As the governor signed the bill into place last week, you are the county health board, and your decision will determine what happens in Saline County. If you're waiting on the city, and I'll give these quotes from Commissioner Davis, the city commissioner. He made these quotes in the city commission meeting. I think it was 2 weeks ago now. He made this quote, and he said, quote, "People need absolute direction in regards to this," meaning they are going to continue to tell us what we can and cannot do. And then he followed that up with this quote. He said, "We have seen what happens when we leave things up to people's wherewithal to make their own decision." And the reason I'm bringing those quotes up is if we're waiting on the city commission to open up this mask mandate and put down some of these things, it's just going to continue and continue and continue. The city's going to say, "Well, wait on county." County is going to say, "Well, wait on city." It's time for one of you just to make a decision, just stand up and say, "We've had enough." You look at Texas, look at Florida, look at South Dakota, look at Nebraska. All of these who have released their mask mandates, their numbers haven't gone up. None of them. There's no data. We keep saying follow the science, and we're seeing now that masks are not the answer. All we're asking is for you guys to give us the same freedom that you give to those who are wanting to wear masks. We're not saying outlaw masks at all. We're just saying let's just draw a line and move forward. And it's time. We haven't seen any significant increase since we decreased the restrictions on capacity gatherings. And I'm so thankful for that. I'm glad that we're recovering. I'm glad that our hospitalizations are minimal. But I think it is time, commissioners, that you just make a decision. Stop waiting on somebody else to make a decision and just make one for yourself. I know it's a tough decision, and that's why we pay you the big bucks, right?
Yeah. Thank you, Mr. Parker.
Thank you, guys.
Thanks. Anyone else?
Mr. Chairman, I do have additional hands raised in the Zoom meeting.
Brad, we have one up here in the audience here first. We'll get with.
You've got a live one, yes.
Yeah.
It seems that folks are.
State your name and address, please.
Oh, Ken Ritz. I live in Saline.
Okay.
If we didn't exhale, it would be a personal decision as to whether we wear a mask or not. What one person exhales,
Speaking to the microphone a bit more.
another person, if they're in the vicinity, is going to inhale some or all of. And so that's what makes it a joint situation. To me, it's just utter nonsense to speak of this as just purely individual, same as if you were driving 100 miles an hour down Santa Fe and said, "Well, I'll drive my speed, you drive yours." It's, tell that to the pedestrian that gets run over. My concern is that where these numbers of
Speaking to the mic, please.
where these numbers for positive cases are coming from. And I say that because as far as I know, there's no requirement that anyone report if they have COVID or have tested positively for the antibodies after they've been sick. Where
That is a requirement that is placed on healthcare providers and laboratories to report those positive tests for
Okay,
infectious disease.
so if you paid the $25,
Mr. Chair, as a reminder, public comment is not a dialogue. It's for the public to just address the commission, so.
if you go to Dillon's and test positively for the antibodies, will that information go to the health department, indicating the name of the individual and that they tested for the antibodies? I'm just curious where, when you say so many cases since the last reporting period, what are the sources? Are doctors required, and are they abiding by that requirement? When they have a patient who comes in and they check the patient and they show that they tested positive, is that information going to the county health department?
Okay.
And I know if people just stay home until they get better, There's no way that I could be on your list.
Your 3 minutes is up. Thank you.
Okay, but if the numbers aren't complete or aren't good,
Okay.
then what we're showing as an improvement may or may not exist.
Okay. Thank you.
This is Commissioner Shadwick, and his questions have already been answered by Mr. Tiller.
Go ahead, Monty. Are you there?
Yeah, my point was his questions have already been answered by Mr. Tiller.
Yes. Yes. Okay. Brad, we have another go ahead person.
We do, Mr. Chairman. Melissa Hendricks has her hand raised.
Okay. Hello, Melissa. You're muted still.
Sorry about that.
Okay.
Thank you for allowing me to speak again. I just want to say that I agree with everything that Mr. Farber said. It feels like that we are that the county commission is in a power struggle with the city commission, and one of you guys needs to take a stand and make a decision. It feels like you guys are just waiting to see what the other person is going to do, and then you'll make your decision. Well, somebody has to take a step. Somebody has to do something to get movement in one way or another. We can't just sit here and keep fighting with each other on who's going to move first. Somebody's got to move. And with our cases the way that they have been, with our hospitalizations the way that they have been, there is no reason to continue the mask mandate. Like Mr. Vidrickson said, or not Mr. Vidrickson, I'm sorry, I'm not very good with names. One of the commissioners said that all of these large events have happened. People are running around without masks. I was in Dillon's the other day and people are not wearing masks. It's not being enforced. What are we doing? That's what I want to know. And we're just sitting here, we are spinning our wheels, but we're spinning our wheels waiting for somebody else to do something. And it's getting really old for the people who want to be able to not wear a mask because that's the freedom that they want to have. I'm just saying, make a decision, please.
Okay, thank you. All right. And let me ask, this is not an RFA. This does not require any action, but at this time, do we want to, any other questions or comments?
Mr. Chairman,
Yes.
do have one additional hand raised in the Zoom meeting.
Okay. Go ahead.
Hi, this is Lene Meyer again. I just want to say I don't see it really as a power struggle between the county and the city. I'm hoping both county and city commissioners are working together and coming up with the best decision for our county and city related to our health. And so I'm not really seeing a power struggle. I'm hoping that's not what it is, but I'm seeing them come together from a sense of common sense and being respectful of both sides of the fence and working together. And it dawned on me as the conversation was going on, I'm so glad years ago we got a wear a seatbelt law passed. And for people who, wow, I would hate to see people have a right to choose whether or not they wear a seatbelt. And I think in this day and time, this issue fits into the same kind of safety measures. So again, thank you for your efforts.
Thank you, Lene. Any other? Okay, Mr. Administrator, do you think, should we go ahead and, have a vote on this? It's just an information item. No, it's an item, but it's.
So this item is agendized for potential action if your commission wishes to take action, as it has been every 2 weeks since July. So you certainly are free to take an action or to not take an action. I've heard some suggestions that different folks have had around altering the schedule, altering the language. If you take no action, we will not be here next Tuesday. We will be here in 2 weeks. If you want us to move that up a week, I think we would need an action on that. If you want us to remove 6-foot language, we would need an action on that. So I think from a staff perspective, we would just welcome any direction. If there is no direction, we'll see you in 2 weeks.
Mr. Chairman, if I might, Mr. Tiller has made his recommendation. And from my perspective, what we need to do at this time is simply a consensus, unless someone wants to make a motion for action. And that consensus is that we are going to continue with the mask mandate and review it. I would like to amend that part of it to 1 week. We will review it in 1 week. We will continue with the mask mandate. That is a consensus, unless someone else wants to make a motion to repeal it. That's their prerogative.
Okay.
Mr. Chair, if I may, I'm ready to get rid of my mask. That's me personally speaking. But when I took the oath, I believe the language said health, safety, and welfare in there. And that's what I'm trying to reason out in my head. And so saying that, 2 more weeks wearing a mask is not going to hurt, or 1 more week. I am not in favor of tweaking this language. We had an opportunity. I think we all had input when we first adopted this very same resolution. Let's let it ride for a week would be my suggestion, and review it. Communicate with the city, as everybody said. That's a given. We need to work together.
Consensus, Mr. Weiss.
I'm for following the guidance of the health director and happy to sit on this for another week or 2.
Commissioner Shadwick, do you have a consensus?
A week is going to be fine. Again, I think that this ends at some point, and some of the comments that were made about the commissioners, the city commissioners' comments do disturb me, but I'm not so sure that that's the majority of how they feel. So I think a coordinated effort is appropriate.
Okay, thank you. And I personally, I would love to see this go away. I think it should go away. I'd really never been a big favor of it, but it's here, and 1 week is, I look at it as going, let's just look at it next week and get rid of it.
Make it a table item? Like, is that a possibility to make it a table item so you have to take action on it next week?
No. Well, I don't.
Like, when are we actually going to, like, force you guys at some point to
Have
take
them
action?
come up.
Yeah, come up to the microphone. Excuse me. Oh, yeah, please.
At one point, we're gonna have to make you guys take action. At some point, you have to do something. We cannot just sit on this forever.
Well, I think that's what we're kind of doing here is making we're taking a course here to sit back and say,
You're not taking any course here.
Yes, we are.
You're taking a course of nothing.
well, ma'am, and I have to, I understand because let's just get rid of the mask and going down the road, but our health director, and I look at it as far, I just don't feel like the embers are out, and I would love to, to me, we've put up with it for a year. I mean, well, even 8 months.
I've never put up with
Well,
it.
but that's what I'm saying. I have put up with it, and I still go out, when I go into a place where I don't know who it is and I'm there, I still wear a mask. Do I want to?
But
No.
that's your choice.
That's it. That's what I'm saying. And you still, like you said.
Mr. Chair, I
Yeah.
believe you have consensus.
Yes.
I think we need to move on with the rest of our agenda.
I was just listening to the lady.
We have made a decision, and that is that we're going to wear the mask for another week.
Yes. So,
At what point are you guys going to do something? Because the city
We do
Well-
not, no, we're done.
well, I know. In a week, we'll
done.
look at it. So anyway, next item, please. We'll move on to the informational items.